Good morning, guys, and welcome to the podcast. I've got a fantastic guest for you coming out of Ohio, Scott Allen. He's going to talk to us all about leadership. And he has this mantra leaders create the weather. And we're going to talk all about co creation of leadership, leading in complex times. And so it would be wonderful to have Scott talk about leadership. And I'm really excited to dive into the conversation. So, Scott, welcome.
Thank you. It's wonderful to be here. I'm excited for the conversation.
Yes, and I know what's interesting. We were talking backstage, and we share similar hometowns. You trained at the Woodlands Athletic Center in diving, and I grew up there, went to school there. And so, talk about your background and how you got started. And you're in Ohio now and doing great work.
Yeah, so that's ages ago that I was a diver. And it was actually, I think it was a junior Olympic qualifying meet, a regional meet in the Woodlands, and just fell in love. Absolutely beautiful area of the world, beautiful facility that you grew up around, just absolutely incredible. So 17 years full-time in academia, professor of management, teaching graduate students and undergraduate students, and really just loved that work, had a wonderful time doing that work. And then recently I've just transitioned out of full-time academia, and I work with Southern Methodist University in their executive education, so working with corporate clients, but then also have a robust client practice here in Northeast Ohio and really all over the country. And so if the conversation is about leadership and how we better prepare people to be successful when serving in these really challenging roles, I'm in. I love the conversation. I don't think anyone has a corner on the market, but especially, Chris, if we talk about the background that you come out of, sir, healthcare, I can't think of a more complex environment to lead in today, just in normal day-to-day work, than healthcare. 24/7 nature of the work, 365. It's regulated, Joint Commission. We've got quality challenges. We've got digitization. We've got all kinds of technological advances. Patients aren't at their best. Families aren't at their best. I just have so much respect for the environment that you spent much of your career in. And then I love the fact that you're doing this now. I think that's awesome.
Yeah, what a fantastic segue and introduction. And like I said, one thing's very interesting in healthcare that I've really observed and noticed, and I made several comments to my colleagues. And there's, especially in healthcare, they talked about this challenging environment. Why aren't there more? Because you work with executives and C-suites. Why aren't there more physicians in the leadership roles? Is it a bias, or is it because physicians just aren't interested? They want to see patients. Talk about this dichotomy that you're seeing.
All of the above, right? I think there's a number of different reasons why that's the case. So first, I think when you're taking a great physician offline, you're taking a great physician offline, and their area of expertise is their area of expertise. And if now we put that person into more administrative roles, that takes them off the floor, so to speak. So you might have that dynamic happening in an organization. It might also be that a physician doesn't really have an interest in leading others, managing others, leading an institute. And I do a lot of work with the Cleveland Clinic, and there's individuals who say, look, I'm super happy just doing exactly what I trained for, which was to provide our clients, our patients, with incredible care, world-class care. That's what my mission is. So I think that can be a little bit of an issue at times. I think also there's a certain percentage that elevate into maybe a first or a second line opportunity. Let's say a charge nurse or a nurse manager, and an individual who was a great phlebotomist, and now we've promoted them to charge or promoted them to a kind of a pseudo leadership role. And oftentimes, Chris, you've seen it, they're set up to fail. We don't train them to be successful in this very new role. So I worked at a healthcare organization in Kentucky for the first part of my career, and we would elevate these individuals to nurse manager, and that person would be taught a little bit about the P&L. They'd know their Press Ganey scores and their quality scores, and then unleashed on the floor. And oftentimes, I think a lot of people were set up to not do well in this new work, which is building teams, designing culture, problem solving, negotiation, influence. There's a whole suite of new skills, mindsets that this individual has to employ that they weren't trained on. And oftentimes they're set up for failure. So I think there's any number of reasons why we see what we see out in the field, out in the wild, so to speak. I go back to my mission, which is how do we better prepare people to serve in these roles? Because I think there's a lot of opportunity. We're not doing the best job we can. And I don't know, I think we can do better. And at least if you look at some of the Gallup numbers about engagement in the US workforce, something around 2/3 of individuals are at work literally right now, and they're disengaged. They aren't all in. And again, culture requires design. Employee engagement and employee experience, it requires design. And oftentimes our organizations, especially today, I don't think are giving the time required for us to truly design what is the employee experience? What is the new manager experience? And how are we setting them up to be successful? Chris, I lost you. I can't hear you.
Yeah, it's interesting because what you said is very insightful. And so diving into the conversation more is one thing is what does it take to be a leader in complex times? Because it sounds like the more and more people I talk to, is it really worth it to lead a healthcare? Or only the people that really want to be there, that really want to make a difference? So what skills or attributes do you believe are need to be a great leader in these times?
Okay. So I'm going to start in a little bit of a non-traditional place. And for me, a couple things come to mind as just baseline factors. So, do you have a person of character? Is this individual rooted in who they are as a human being? And are they aware of their values? Do they have a moral compass? That's number one. Number two, is this individual mature? You know what it feels like to be in a position where there's an authority figure who lacks maturity, who is small minded, who backbites, who plays politics, who just isn't an individual. They're in it for themselves, so to speak. They're in it for development of the team and for others. And so, do you have an individual that is mature? And then, third, do you have an individual that is a learner, a lifelong learner? I just previously listed off a whole suite of skills and knowledge that an individual needs to bring to the table if they're going to serve as a leader. None of us can possibly know all of that. So, are you a lifelong learner? And if your job now is to lead, are you learning about leadership? Are you reading the book, The Leadership Challenge by Jim Kouzes and Barry Posner? Are you reading Five Dysfunctions of a Team by Patrick Lencioni if you're actually in charge of developing and building a team? So, are you becoming an expert in this activity called leadership? So, that lifelong learning component is so incredibly important because that functional expertise that you have in orthopedics isn't really going to serve you necessarily well when you're leading a team. So, those are three things that really come to mind for me as just baseline expectations. You have an individual that's into learning, you have an individual with a certain level of maturity, and you have an individual who has character and they are an upstanding citizen in the organization that people would respect in the first place. Now, complex times. So there's another thing here that's really important. When leading in complexity, and for listeners, there's an incredible Harvard Business Review article called, oh my gosh, Snowden and Boone. And I will think of the title in just a moment. But this beautiful article from 2007, it really highlights four different types of problems that we're working on. And it's a simple problem, a complicated problem, complex, or chaotic. Chaotic is an emergency. We're going to keep that on the side for right now. That's wartime. That's something that came out of left field. We weren't expecting to it. That requires a certain type of leadership. Simple or complicated problems, well, there's some known knowns. If it's a simple problem, we know how to solve it. If it's a complicated problem, we might need to call an expert. But when you get into complexity, there's an infinite number of variables at play, and no one person in the world has the answer. So in this article, A Leader's Framework for Decision Making, Snowden and Boone, I believe it was 2007, Harvard Business Review, they beautifully outline these four types of problems that leaders address all day long. When we're in complexity, there's no person in the world we can call for the answer. We can't call someone and say, hey, we need 5% more market share. Can you give me the 4 steps? It doesn't exist. Hey, I've got 6 people here. I need to create a high functioning team. What are the 3 steps I need to take? It doesn't exist. Ultimately, what's happening when we are problem solving in complexity, we're running experiments. And hopefully, we have a team of individuals who have the psychological safety after we've put the kind of great question in the center of the table. We have a team of individuals who are working that problem, who are bringing their voice to the table. They don't necessarily get their way every time, nor does the leader get their way every time. It's we are coming up with what we think is the best path forward, given what we know. So oftentimes people think of leadership as the person who has all the answers. I think, especially in complexity, a great leader elevates the right questions. And those questions then are put on the table. And we've created a space where people have the psychological safety to bring their perspective, regardless of how odd it sounds or how weird it sounds. They can bring their perspective to the table. And we have some pretty solid norms as a team. I'm not always going to get my way. It's not always going to be my idea that's chosen. It might be a combination of ideas. But ultimately, to serve the patient, to serve the organization best, we think this is our best path forward. So when it comes to leading in complexity, we need other eyes. We need other minds working the problem authentically, transparently, and we each suffer from about 180 cognitive biases. So each one of us is very limited in our ability to truly design the best experiment for us to see if it moves the needle. Now, again, when we're dealing with complexity, think about a problem like cancer, for instance. Thankfully, individuals their whole adult life have been going to work and failing and learning, failing forward, and helping us better understand this thing called cancer. And we're never going to quickly solve, but we've been chipping away. And now all of a sudden we have immunotherapy and we have CAR T and we have some other interventions that are emerging as other potential opportunities. And we've been working the scientific method, right? And that's how, in many ways, we address complexity. What's our testable question? What experiments can we run? What results did we get? What did we learn? And it's an infinite loop. So how do I build a high functioning team? How do I design culture? How do I lead Charlie? You're running experiments oftentimes. And as soon as we have a human being, there's an infinite number of variables between me and you, Chris. So we're in that realm of experimentation. That makes sense?
Yeah, it makes perfect sense, and I really enjoyed that, and I think the audiences get it will get a lot of value, the on the when an episode airs. And so the next question I have for you is how have these attributes changed in the information age as opposed to the industrial age? Because every time I hear it used to be like CEOs never got fired or they stayed on for a long time, and now it's like tenure of a CEO is less and less. And how have these attributes changed from the industrial age?
I think you very much had a paradigm of the leader is the leader, the authority figure. And in Henry Ford's day, maybe things were a little more complicated when it came to the assembly line than complex. If you think about the shifts, Chris, that are happening across the globe right now, we've got incredible economic shifts. We've got incredible climate shifts. We've got incredible shifts around digitization, generations in the workforce. We have so many shifts that are occurring that complexity is everywhere. So I think some of the challenge that we have right now is that maybe in the 60s and 70s and 80s, of course, complexity existed. Of course it did. Maybe not on as many fronts as it does today. Supply chain challenges, war, any number of shifts that are occurring right now that are disrupting the norm and the pace at which all of that is happening, it's just mind-boggling. So I go back to, I think today you need a leader who can be confident yet humble. You need a leader who can elevate the right questions for the team to work. You need a leader who's constantly learning because the knowledge of 2023 is no longer applicable in 2025. So you need an individual who is mature enough, who can acknowledge this, like, and confident enough in their own, hey, you know what? I also don't have the answer. Let's come up with what we think is the best path forward, right? There's a humility and a confidence in that statement. And I need to be more of a both and than an either or. And so we would call that the both and leader. Like I can hold both of these polarities or these tensions, and I don't have to be insecure to let you know, Chris, that I don't know the answer. I've never lived through a pandemic. I've never lived through some of these supply chain challenges, this rate of innovation in healthcare. We all have to be humble and have a sense of humility when tackling some of these things. So it's that both and leader versus the either or command and control. I know what's right. That's just a recipe for disaster. And you've worked for those individuals. You've worked with those individuals, and they're going to be flying blind because people are going to sit in the meeting. They're going to nod their head. There'll be a meeting after the meeting where all of us say this is going to be a train wreck. And that leader thinks they have buy-in, and they've just made what we all know is a bad decision or not the best decision. And boy, leaders need those minds. They need those minds at the table.
And the follow-up question I have for you is, given if you look at healthcare and these kind of legacy industries,
Yes.
very slow moving, and especially we'll talk about AI in the next section, but how is a leader to balance this pace of innovation, adopting new technologies while being stifled by regulation and bureaucracy, and how do they juggle those two?
That right there, Chris, is a beautiful question for the team to work. That's a beautiful example of exactly the type of question a senior leader in a healthcare organization should be asking right now. How do we balance these competing commitments? What do you all think? Where should we be a little more aggressive and bullish? Where should we be a little bit more bearish? Where should we hold off? None of us have the answer. That's not a question that any one person has the answer to, but we can think about it and we can come to our best guess as to how we think we should proceed. Pay close attention to what we're learning, see if we need to shift and adjust. It's likely we will based on the data that comes back. So in many ways, I loved that question because you just made my point. No person can answer that question. The only hope in hell you have is that you have a team of people that can work that question authentically, transparently, bring their full perspectives to the table and come up with what we think our best guess is. There may be parts of the organization, maybe it's cardiac and thoracic surgery, that we need to be a little bit more bullish on. In other areas of the organization, maybe we need to throttle back a little bit. That is a never ending dance. It's an infinite game. It's an infinite game. Do you have some people playing with you who are helping you chart the path forward? And if they're not, and we've been in that meeting, all of us have been in that meeting I just spoke of, you're flying solo, you're blind. And with all these cognitive biases that all of us suffer from, you're in big trouble.
I really love that question. And then to an adjacent question that I have for you is, in with this oncoming wave of AI, and especially because you have a seat at the table talking to these leaders, how are healthcare organizations and leaders looking at AI, the potential use cases, the potential disruptions, and how should a healthcare CEO or executive start to think about AI and positioning themselves for this new technology?
Great question. Okay. Couple things. None of these CEOs in healthcare right now went to school for artificial intelligence. That's not a thing necessarily. Maybe there might be one or two that went to Carnegie Mellon and studied machine learning or expert systems back in the day, but that's likely not the case. So again, do you have an individual that is humble and is learning rapidly? And so it's one of the most important attributes of an effective leader, that humility to say, I don't know, that humility to say, I need to learn. And so a couple things come to mind for me. Chris, when you and I were coming up, and I don't know your age, but I'm just going to guess, IT was this place in an office in another building over there, and it really just got you and your computer set up. Now, IT is blending with strategy. It's becoming a strategic imperative for organizations to be thinking about quantum computing, thinking about artificial intelligence, blockchain technology, sensor technology, how all of these technologies enabling disruption are going to impact the work. And the reality is, there's a ton of startups, smaller tech and big tech, as Amazon starts looking at getting into healthcare more and more. So you've got these big tech and you've got med tech, smaller kind of organizations trying to ping some element of the healthcare system, all kind of vying for what is a multi-billion dollar industry, a piece of the pie, probably $1 trillion industry. So, couple things. Do we have a team of individuals who are tech literate? I don't mean that these people know how to code in Python. I don't mean that these people are experts, but I want these individuals to have a sense of how these technologies enabling disruption, sensor technology, Internet of Things, any number of different interventions, how they're being leveraged, how they're being thought of in different spaces. And so that tech literacy means that you're curious, you're paying close attention to the fringes, the margins. That's where a lot of this innovation is occurring. What's happening in some of these med tech companies? What's happening at these med tech conferences? What is big tech's next big play? Having an awareness and having some individuals in the organization who are paying close attention to those spaces is incredibly important. So, do you have a team of people with some level of tech literacy? Do you have another team of people who are really paying close attention to the margins? And then are you as a leader and a leadership team interfacing with some of these experts from around the globe and getting their opinions, their thoughts? I was at a luncheon a few years back with Rich Kramer, who at the time was the CEO of Goodyear. And I said, so what's the latest, Rich? What's going on? How are you thinking about tires? And tires, you wouldn't think that there's all that much. They were thinking 7 steps ahead. He said, we just had the head of Google's autonomous driving program come in to speak to my board. And that's brilliant. So who are those thought leaders we should be interfacing with? What are those podcasts we should be listening to that in that med tech space are going to help shape the narrative, shape the story moving forward? And then ultimately, again, if it's strategy, it's a guess. And there's no person we can call in the world to say, hey, these 4 things, if they're in your strategy, you're good. You're going to increase market share and be totally successful. It's a guess. It's our best guess strategy. So are we pinging those external experts? Are we building some bench strength within? Are we curious as an organization? And the challenge here is that we have to carve out, Stephen Covey would call it the quadrant 2 time, those things that are important, but maybe not urgent. Are you carving out that time as an organization to do some learning in this space, prioritizing that time so that you can ensure that relevance? That's a few ways that I think about that question, Chris. What do you think?
Well, it's amazing because it's just because I have followed this because I'm more of an entrepreneur and I just like because I know how these legacy systems work and it's like
Yeah.
very slow. But if you look at like Amazon, Google, Meta, like the big ones, Apple, and they're all, especially Amazon, I
Yes.
watched them. They're One Medical, and I potentially see something hopeful and bright, but they failed 3 or 4 times before that. And look at Mark Cuban; he's doing a lot of work trying to disrupt the pharmaceutical industry.
Yes.
And a question I have is, do you see like hospitals in the future kind of be getting unbundled where basically people go to the hospital if they're like in a trauma or they're just like sick and dying and basically all the healthcare gets spread out into like clinics and telemedicine and homes? And is that how healthcare leaders are thinking? It's really interesting because there's no one clear answer. So
There isn't. I think it's probably going to be all of what you just said. So much of it, we know, and push back if I'm wrong here, but we know that if people are in their home, they're going to get, and their home is a healthy place, they're going to get better faster. Can we do some of this work in the person's home, keep them out of the hospital where honestly a lot of things are spread in the hospital? So can we keep them in their home longer? Can we add in the convenience? I think there was something like, I'm going to get this wrong, Chris. It was in the billions of telehealth visits. And there's some times where all I want, if you're going to make me, I have psoriasis. If you're going to make me have an appointment, just let me put it on an iPad and show you the little patch of skin that I need the cream for. Don't make me come back in. So there's definitely use cases for telemedicine and telehealth. And I love that exists and that's an opportunity. You look at some of the innovations around prescriptions like Hims and Hers or Henry Meds. That's interesting. Heck of a lot easier than going through. I just was in this labyrinth, Chris. You know what this labyrinth looks like. I was in this labyrinth of my physician, the insurance company, the pharmacy, the specialty pharmacy, and the drug maker. Five, none of them speaking with one another, not able to get a couple people on the line together, and just this labyrinth of just frustration. So I think in many ways there is an opportunity to disrupt. There's an opportunity to streamline and clean up how we do some of this work to make it more efficient for all involved. And I think the folks who really figure some of that out, wow, that's gonna be pretty darn incredible, but you're gonna see wearables. We're really, "Hey, your heart is not performing correctly. Come into the healthcare system. Come into the doctor today." Maybe my Apple Watch is already doing some of that. Maybe I have something in me that is monitoring my key vitals, and all of a sudden, I'm getting pinged when I need to go in. So, if you think about the future of healthcare, there's so much opportunity. And even some of these startups around proactive medicine, will I pay 5 grand to have an MRI proactively and get some other testing done that helps me monitor my health in real time proactively? I think there's a lot of opportunity. I think in many ways, the aspects that are broken in the system right now are business opportunities. And that's where you see Cuban going. That's where he's playing. He sees the opportunity in all of that carnage and he's trying to untangle it, right? And use capitalism against itself.
Yeah, it's been a great conversation, and we need to have you back on for a second. And how can people find you and follow you and reach out to you and find out more about you?
Sure, sure. So website, scottjallen.net. That's where I live on the internet. And then also Scott J. Allen on LinkedIn. So those are two great places to get a hold of me, scottjallen.net or LinkedIn, Scott J. Allen.
Yeah, I really enjoyed this, and keep up the great work.
Oh, thank you, Chris. I love the conversation. It's so much fun. Thank you for the good that you're doing in the world. You're spreading knowledge and information, and you have such an interesting purview based on your background. So good work to you as well.
Thank you.